How's it going, everybody? This is Ryan Bristol, physical therapist, and today I'm really excited to have a very special guest with us today. Her name is Ashlee, and Ashlee and we met each other through this Facebook group. And what I'm really excited about is that Ashlee can tell you her story with her history with low back pain and what has led her to be recovered at this point. But here is Ashlee. Ashlee, would you like to introduce yourself?
Yeah, hi, I'm Ashlee, and I've been following Ryan's back pain program, and it's helped me an awful lot.
Ashlee, if you're able to just kind of go back and share whatever you feel comfortable with about your history with low back pain, like how long has this been going on for you? Like how many years have you had back pain?
I've had back pain for an awful lot of years, probably about 25 years. And it's progressively got worse over the years through my work as a healthcare assistant. So yeah, it's hindered my life quite badly. So
yeah. The pain for over 20 years, and over these years, I'm sure you've talked to many doctors and healthcare providers about this condition.
Yeah, I've seen physiotherapists, not occupational therapists, osteopaths, chiropractors, GPs. Nothing's really helped with my pain at all. So, and in fact, some physiotherapists have actually made it worse.
Okay. So like a lot of people with the years of back pain, you've gone through seeing pretty much every healthcare provider. They can give you the best chance at helping you with this. But after years of trying osteopaths and physical therapists and your general practitioner, you still ended up stuck with low back pain.
Yes.
Okay. So you've already tried basically everything you could. Nothing has helped. And usually doctors will start to do more testing, like you'll get an X-ray or even an MRI.
Yeah, I've had X-rays, MRIs.
Okay. And can you share a little bit about what the main findings were that you had the MRI done and your doctor said what they found in your MRI?
My first MRI found I've got a disc has gone or bulging at L5S1, which is touching my sciatic nerve.
It's hitting the sciatic nerve.
Yes.
Okay.
Which is causing some of my problem.
Sure. And okay, so you have the MRI, it confirmed you have a bulging disc and it's pressing up against one of the sciatic nerve. What were your overall symptoms like at this point? For example, you don't have to, repeat this, but some people will say I have back pain in the center of the back. Sometimes it goes to the right side of the back, and sometimes I get a sciatica pain and it shoots down my leg. What were your symptoms like?
My symptoms were mainly pain in my right buttock area and my lower back. So it didn't particularly go down my leg, but it was really painful and uncomfortable.
Okay, so mostly right-sided back pain, and then it'll radiate to the buttock area?
Yes.
Okay. And this pain, like you said, you've been dealing with it for a good 20 plus years.
Good 20 plus years, but definitely in the last 4 or 5 years, it's actually got worse. So yes.
Okay. And now that the pain is getting worse, you tried working with a lot of different healthcare providers. Throughout your day, what were some of the things throughout the day that you're having trouble doing because of this pain? Physical activities, work?
Physical activities, things like picking the cat bowl up off the floor, putting the washing in the washing machine, low down jobs. Yeah, it would affect my day-to-day work. Sitting down, driving, lots of things.
Yeah. Yeah, so not being able to sit and bend and do simple things around the house, like clean the house, do the laundry.
Yeah, you it's really painful to do simple jobs.
Yeah. And how about your work, your occupation? Did this slow you down in any way?
It definitely did, yes. When you're having to shift or move people that are 14, 15 stone, when you've got a bad back and you're having to rely on the other person to be just as good or better than you are, it yeah, and then there's days where you just can't do your job because you're in so much pain.
Okay. And with your work, you have to move your patients around, like transfer them around. Is that part of your job?
Yes,
Okay.
or move them around in the bed as well.
Yeah, so it can be quite strenuous. So again, more bending and lifting and like you said, there are some days you couldn't even do it.
Yes, that's right. Yeah.
Okay. And did you have to miss out on any work because of this? Like you had to take a week off because you were just in so much pain?
Um, you can't really afford to take time off work because you're in so much pain. So
Kind
you
of
just have
fight.
to continue.
Yeah, just kind of just fight through it.
Yes,
So
take the
that's yeah.
painkillers and carry on.
So with this back injury, it's been going on for a long time, and you said the last 4 or 5 years just became worse. And even the simplest of activities, like picking up a water bowl for your cat off the ground,
Yes,
yeah. So that's quite limiting. It sounds.
very limiting some days.
Okay. So those are some of the day-to-day things that were holding you back and giving you pains and difficulties. Anything like your recreational hobbies that you had to put on hold because of this? Sports?
Yeah, I had to put on hold my cycling because that was really uncomfortable. I did push on with other things like karate, but COVID stopped that for a good 18 months. So that didn't help. So
Sure.
everything sort of got stiffer and stiffer as things progressed.
Right. Right. And then when did you join this Facebook group? It was like a 6 months ago or a year ago?
Not quite a year ago.
About a
Just
year
over,
ago?
yeah, it would have been just under a year ago
Okay.
when I came across the group.
So yeah, Ashlee and I, we found each other just right here in this Facebook group, and you're all the way in England, correct?
Yes, that's
So
right.
we're literally on the across opposite ends
Across
of
the
the
pond.
world, and just fortunately we were able to find each other on Facebook in this group, and then Ashlee and I just had some conversations back and forth just
Mm.
to well, for me as a physical therapist to learn about what she's been going through this whole time, and we had some conversations, and I explained to Ashlee how I help people through this process. And about in the middle of this summer, Ashlee took a leap of faith and said, "Okay, Ryan, let's do this. I really want to, improve my condition." So she decided to work with me on this condition, and we worked together for 8 weeks. And we just
Mm-hmm.
started from the beginning and just kind of built from there. I guess not going into too much details, Ashlee, but when we first started working together, how many exercises did you start working on when we going back to the first week or two?
On the first week or two, we did 2 exercises to start with, which I did several times a day. And yeah, it was a massive improvement within the first few weeks.
So in some of my conversations in the group, I talk a lot about directional preference stretching, and there's different ways of going about directional preference stretching, but whichever route that is best for the individual, directional preference stretching it's essentially it's one or two exercises that's going down to the very specific injury of the spine. So the routine can be quite simple, but very effective and specific to the injury, which is why people get fast results. Really, you're just working the same system over and over and over again, but you're targeting the exact part of the injury, and that's why a lot of people can get results in a real short amount of time. So actually, those first two exercises you did, you did only those two for a while. How many weeks until you really felt it was benefiting you?
Or was it? I noticed fairly early on, but probably about 2, maybe 3 weeks in, and it was definitely noticeable how much of a difference it was.
So you hear that, everybody? So 20 plus years of back pain and even pain radiating to the buttock in 3 weeks of just doing this system, this approach, a noticeable improvement.
Definitely.
So when I work with people, I like to say 8 weeks is a pretty perfect amount of time to work on this and really learn everything that you need to treat and learn everything possible to take care of your injury and progress in a organized fashion. Ashlee started off with directional preference stretching. In 2 to 3 weeks, she was feeling fast results. And at that 2 or 3 week mark, we just started building a little bit more from there, just keeping everything quite organized. What would you say, Ashlee?
Oh yeah, definitely. Yeah, definitely organized and definitely progressed nicely.
Okay, perfect. So when we were working together, Ashlee worked on just a couple exercises for 2-3 weeks. And then from there, we're able just to kind of gradually build with a couple new things every 2 to 3 weeks. Before you know it, we're at week 8. Ashlee has learned and mastered directional preference stretching. She was able to progress her mobility with other stretches, and we then started working on gentle strength and endurance training. And then essentially the final step was just getting back into functional activities. The last couple of exercises we worked on were like squats and lunges, right?
That's right, yeah.
And Ashlee mastered that. I mean, you maybe felt some fatigue because you haven't done it in a long time, but did you have any? So this is when we're getting closer to the 8 week mark. Ashlee is getting close to graduating already. So when you first started doing those squats and lunges and the lateral stepping with the theraband, was your back okay?
Yeah, my back was fine, no problems. So yeah, it's just using the muscles I haven't used for a while.
Right. And then Ashlee started training herself essentially to get back into karate class that she hasn't done since 18 months.
18 months.
And how was your first karate class?
Yeah, it was fine. A little bit of muscle fatigue, but obviously I haven't done karate for 18 months. So
hey, who would
yeah, no.
You haven't done something in 18 months like karate, I think you're going to be a little tired from it.
Yeah, I was.
Excellent. So 20 plus years of having back pain and radiating pain and all those healthcare providers that you worked with, and you just did this for 8 weeks. And, so you've passed the 8 week mark, you graduated already. What do you think about this whole program that we did together?
I think it's brilliant. Certainly a lot better than the ones that I've used before. Especially with the graduated stages of adding in exercises really does help. So yeah, I would certainly recommend it.
Great. Like yourself, Ashlee, most of the people in this group have been to physical therapy probably more than once. They've probably worked with several different physical therapists, maybe even osteopaths. So people can be quite frustrated that they've seen all these different healthcare providers that should have helped, but didn't for some reason. And this is what happened to you as well. What would you say is the biggest difference that you found from what you've done before and the program that we did together? What do you think was so different? Or
the first thing is you actually listened, which was good. So you tailored the treatment towards me especially. The second thing is you didn't give me all the exercises in one go. on a sheet, a printed out sheet, and then tell me to go and do them. And then that does more because that hurts. So then you don't want to do it. So it was completely different, and it was more proactive and actually helped more than the other physios that I've seen in the past.
That's really common, actually, that someone on the very first day of physical therapy will be given a whole handout of maybe 5 exercises on the front page, and flip the page over. There's 5 more exercises, and they just say, just do it all, and do it for a few weeks, and
it will work.
Yeah. So what's wrong with that? There's no organization or even what to prioritize.
No.
So what I do with all my patients, including what Ashlee and I have done together, is we do first things first is control the pain, right? The pain is sporadic, it's unpredictable. So that's what directional preference stretching is about. It's to control the pain and control it fast. And it allows the spine to heal because it's very consistent. Ashlee does it every single day, multiple times a day. That's going to allow her spine to heal, and her pain is going to become smaller and smaller. Once we have accomplished that, like she did in 2 or 3 weeks, then we start to build onto the next thing. And then over the course of 8 weeks, now she's back to squats and lunges and karate class. So
yeah.
So perfect.
Definitely. Yeah, it definitely works.
So and actually, the activities that used to cause you pain, like bending and lifting things and doing chores around the house, how are those activities now?
I hardly even notice. Unless I've had a day where I've been really lazy, there's no pain. And it's really good.
Excellent. And the other controversy that a lot of people say that it's impossible, there's no way that this is effective, is learning how to take care of your back, especially if it's been going on for years and years and years, to learn how to take care of it virtually, remotely, which I tell people over and over again, that's completely false, especially with today's modern day technology. We got Zoom, we have email, there's videos and pictures and Facebook Messenger. We can stay in contact anytime we want, but to really take care of a problem injury, in my opinion, the hands-on, having to be there physically to touch the person is completely unnecessary. And this is proof that that this stuff does work. What are your thoughts on the virtual versus in person, Ashlee?
I'm actually all for it. I do like technology, and I think technology in healthcare is going to really progress. And I think actually doing Zoom calls and Facebook Messenger, I think it's been actually better than having a physiotherapist where you have to go through the receptionist, then make an appointment, and it's been a lot better and a lot more hands-on.
Yeah, like you said, you have to set up appointments, and hopefully you can find a convenient appointment time for your life. But what Ashlee and I do, we get started whenever you're ready, and let's have our conversations. Let's hear about your history with your back problem, and then okay, now I got the idea. Boom, let's get you going with this, and you just do it whenever you get the opportunity to. Do it at home, do it at work. You just learn it and do it, and then look at you now. I mean, 8 weeks, and you're out doing karate class now.
I am. Yep. Yes.
Yeah. So you did awesome during this 8 weeks, and it was a pleasure working with you. And of course, I'd love to be in touch with you anytime. And the nice thing is you have a routine, a protocol you can work on anytime you want for the rest of your life. This is the healthiest routine for your low back that you'll be able to take with you forever.
Oh yeah, definitely.
And I really think that the chances of you needing more MRIs or physio appointments or osteopaths are going to be unlikely.
Yeah.
Unless you really need to go see them, of course.
And I think I'd rather get in contact with you first,
Perfect. Yeah.
to
And of
be
course,
honest.
I'm always going to be here.
Yes.
Yeah. Um, I think that's all the questions I have. Do you have any final words for the group, Ashlee?
No, I apart from, if I would do it if I was you. It certainly helped me, and I think it would help somebody else as well. So yeah,
All right. Well, thanks,
give it a go.
Ashlee. I'm sorry.
Give it a go.
Oh, yes. Yeah, you hear that? Give it a go, because you could have had this problem for 20 plus years, and kind of like what Ashlee said. I mean, I can see how people can be really frustrated and discouraged because they didn't get the right help. But this is completely doable. You just have to learn it and do it, and then you have a success like how Ashlee did. So
Yeah.
so and basically with this approach to directional preference stretching, when you do it, your body really doesn't have a choice but to respond to it. You do directional preference stretching, your body will respond to it one way or the other. It'll make you feel either incredibly great and your pain will drop fast, like what happened to Ashlee, or some people, they might try it and maybe it sets off their pain and makes them a whole lot worse, which is okay, because we see what's making their symptoms worse and we just have to adjust and do a different approach of directional preference stretching. So that's the other beauty of it. It's fast. It's noticeable pretty much the second you do it. Like you do the routine, within a few minutes or even a few days, you're going to know how your body is responding to it. So it's that fast for everybody.
And it's more personal.
Yeah. Yeah. It's just very, very specific to the problem in the spine, the disc, the facet joints. You got stenosis, arthritis. It doesn't matter. It's targeting every single one of that, depending on what approach you're going at. You just got to do it. All right, Ashlee. Well, thank you so much for your time. We'll be in touch soon.
No, thank you.
All right. Well, thanks, everybody. Please let me know if you have any questions about today's conversation. Put some comments and questions in the comments section, or you could even message me personally if you have if you want to talk more and see how this can help you. All right, Ashlee.
All right, thank you.
Well, have a good night. Thank you so much for your time, Ashlee.
Thank you. Good night.
Bye. Good night.